Hello, and welcome to Diagnosing the Barriers, the Right to Health in Israel and the OPT, a podcast from Physicians for Human Rights Israel, or PHRI. I'm your host, Natalie Foster. PHRI is an Israeli nonprofit organization that promotes the right to health for all people living in Israel and the Occupied Palestinian Territory, or OPT, through the direct provision of medical care and policy change efforts. Today, I'll be speaking with Nili Alexandrovich, an advocacy coordinator with PHRI's Health Policy in Israel Department, about the cost of prescription medication in Israel and its impact on vulnerable populations, especially in light of the financial crisis caused by the war. Nili, thanks for joining me.
Thanks, it's good to be here.
So to start, I'm assuming many of our listeners are not familiar with how the Israeli public healthcare system operates. And I think it would be helpful if you could give a brief overview of the healthcare system here in Israel. How does it function and operate? How does a person access medical care, and through which institutions?
Okay, so Israel has a public healthcare system which covers all residents. And under the National Health Insurance Law, all residents must be members of one of four health funds, or Kupot Cholim in Hebrew, which are organizations tasked with providing healthcare services, and they are regulated by the government. So eligibility for services depends on paying a designated health tax, and there are also co-payments for medications, certain health services. And the law sets a compulsory health services scheme, which all health funds must provide. So it's called the Health Basket, or Sal HaBriut. And in addition to that, all health funds offer voluntary health insurance, which is VHI, in an added cost. And this is also regulated by the government. So basically, you choose your Kupat Cholim, and you can access healthcare providers, clinics, and hospitals that are either directly employed or owned by the Kupa, or are in network for it.
And so the department that you work in at PHRI deals with inequalities in access to healthcare between different population groups and areas in Israel. Can you say a few words about some of the issues that you encounter in your work? Who struggles in accessing healthcare in Israel? And what are some of the main reasons for these inequalities, considering that there is a functioning healthcare system?
Yeah, I think it's important to understand that there is a public healthcare system, and it's quite good. But also it has some systemic problems, especially when it comes to vulnerable population groups. So if you live in the center of Israel and belong to the middle class, you will probably have good access to services. And if waiting times are too long, or you need a specialist who only works privately, you will be able to use your voluntary health insurance, or in some cases you have private health insurance, and you can work with that. But if you live in the peripheral areas, that is the north and the south of Israel, and you come from low-income household, you will face long waiting times and not enough specialists, and certain treatments and tests might be provided only in hospitals in the center of Israel. And that's a major problem. And if you're poor, you won't have VHI, voluntary health insurance, or private insurance, and you are totally dependent on the public system. And also, co-payments are a big problem for people with low incomes, and they can lead people to giving up treatment or having to choose between treatment and other basic needs. And this is a major problem that we are dealing with lately.
And so, you started to talk a little bit about this medication co-payment. So how do people get medication in Israel? Is not free. So how do people pay for it, and sort of what are...
Yeah. So medication isn't free unless you're hospitalized, and then it's covered. You need to pay co-payments for all outpatient medication. They're usually 10 to 15% of the drug's cost, unless it's a very cheap drug, which costs under 19 shekels, which is about $5. There are some financial protections, that is discounts and payment ceilings that are supposed to make sure people will be able to afford medications, but unfortunately they're not enough. So we have data from research by the Advas Center in Israel that they checked statistics data from 8 different countries in the OECD. And the out-of-pocket payments for people over 65 in Israel were the highest in all of those countries between the years 2004 and 2015. So Israel is not in a good place when you compare it to other OECD countries.
And that's like the payment when you get your prescription, you go to pay at the pharmacy.
Yeah. So the data from that research is for out-of-pocket payment for medications and other health services, not just medications.
Okay.
But it goes to show the total burden that co-payments put on households in this case of older people, but not just.
Yeah. So and that leads into my next question about the populations who maybe are more impacted by medication payment. And you mentioned having to choose sometimes between payment or like getting medication or not getting medication. And then what's the health impact that this has on these populations if they can't afford to buy medication?
Yeah. So as I mentioned, low-income households are the ones most impacted by the co-payments. That means, for example, older people, which usually take a lot of medications because they have chronic conditions, and also they have lower incomes after retirement. So, and of course, low income in Israel, as in other countries, is higher among minority groups. So those are vulnerable populations. And regarding the impact on health, the latest data we have is from a survey of the Israeli Medical Association from June 2023.
Okay.
And in that survey, 17% said that they had to give up buying prescription drugs because of the cost, which is a lot. And those are insane numbers, but in our population, it was 29%, which is just, I think, crazy.
Yeah.
And giving up treatment because of cost means, of course, more suffering, worse health, and sometimes need for further treatment or for hospitalizations. So it's not just immoral, and it's basically stupid from an economic point of view.
Right. Creating more burden in the long run.
Yeah. And on the one hand, there is a consensus today that prevention is important. But on the other hand, we create barriers which cost the healthcare system much more in the end. So, and I should explain that in Israel, hospitalization, although it's very expensive for the system as a whole, costs nothing for the patient.
Oh, wow.
So, and there is no co-payment. So the whole system is like backwards. I mean, it's upside down. We ask for money, for payment, for medications that are usually not that expensive, and that can prevent costlier treatment. And the whole structure of where the system takes co-payments, makes people pay for treatment, is kind of backwards.
Okay.
Because we make people pay for drugs which are not that expensive, and they can prevent treatment that costs a lot more.
Yeah.
And then we hospitalize them for free, which is good. We need to keep that, but we also need to eliminate the co-payments.
Yeah. Right. It's not focusing on prevention of disease or health incidents. It's like when you have the problem, then you don't have to pay for it.
Yeah.
But it's forcing people to pay for something in the beginning that maybe they can't. And then creating burden on the system when it gets
people
worse.
Just have to get more sick to get sicker and sicker to get free healthcare. It makes no sense.
Absolutely. Yeah, that feels very backwards.
Yeah.
I'm curious also, did the events of October 7th and the ongoing war as a result exacerbate existing economic hardships for vulnerable populations? And have we seen sort of any changes and trends regarding people's ability to buy medication because of the war? Or
so things are definitely worse, both economically and in terms of health. People struggle to make ends meet. A lot were economically affected by the war, and many are still displaced, mostly people from the north, but also from the south. And also the war has a major impact on health. First of all, of course, mental health, but stress is also a cause of many physical health problems.
Yeah.
So we don't have any new official data from since the war started, so we can't say for sure. But from the information and the input that we're getting from the populations that we work with, and also from other organizations, things are getting much worse. And it's definitely worrying.
Yeah. Is mental health covered in any of?
Yes and no, because there is a public healthcare psychological treatment, but the waiting lines are so long; they can be a year and more. So usually people just do it privately.
Yeah. Okay. And so PHRI has a project to help vulnerable populations who are struggling to purchase medication to buy their medication. Can you give some examples or stories that you've encountered through your work that demonstrate why there is a need for payment assistance beyond the need that you've described?
First of all, I just want to say that the demand that we found for humanitarian aid and assistance in Israel that we are not used to, that's the first time we're doing that. It's really worrying for us. And we are glad that we have a generous donor that, gave funding for this project. But we think this is really the responsibility of the state.
Sure.
One example I can think about is part of the project is that we financed weighted blankets and vests for survivors in one of the kibbutzim from the south, from the Otef, from the Gaza envelope. The need there was huge, and they were very thankful for the donation. And that's a first for us, being, in the position that we need to donate humanitarian aid to a kibbutz in Israel. Another case I can think about, and it's a case of a woman from one of the unrecognized Bedouin villages in the Negev. She's divorced. She has 6 children, and she lives in extreme poverty. And she needed medications for chronic health problems for her and for one of her children. And the medications cost about 100 shekels, which is like $25, which sounds not a lot for most of us. But for her, it was impossible. She couldn't pay them, and she didn't take the medications. She didn't have the money. So they didn't get the care and treatment they needed until we came into the picture. And it's just, for me, it's horrible.
Yeah.
I just, those kinds of cases, I think, simply shouldn't happen in a country that prides itself on its strong public healthcare system.
Yeah, for sure. It's like there is a public healthcare system that works well for the people, for most of the people, but the people who need it most are left sort of to fall through these cracks and suffer.
It makes no sense because really just, of course, morally for me, it's heartbreaking and and it angers me. But also economically, it makes no sense that people will need to give up treatment which costs $25 and will get much worse.
Oh, absolutely. And so what do you think needs to happen on a policy level to ensure that that this is taken care of, that all Israeli citizens can access the medication they need through the public healthcare system? And have any recent policies come up and have been proposed or implemented to address this?
So there were some changes in the past decade, but they were mostly minor. And in the last few years, nothing new has been proposed. And it seems the issue was somehow forgotten. And I find it strange because the data we have is not good. So we think the solution is not difficult to implement, except finding the funding for it, of course.
Yeah.
And in PHRI, we believe that the right solution is to eliminate all co-payments for prescription medications. And the reason for that is that with prescription drugs, we have good gatekeepers, which are the doctors who write them. So it's their job to make sure that people get only the medications they need. And if, as a health system, we are worried about overuse or over-medication, the solution isn't financial barriers on the patients. It's better management and education of the doctors who give the prescriptions. And in that context, it's important to understand that research from other countries show that medication co-payments cause more harm than good. We also have research from Israel, which shows that for low-income patients with chronic conditions, eliminating co-payments results in better adherence and better health outcomes.
Mm-hmm.
So we know that it's not easy to find the funding to eliminate those co-payments, but we are certain that all in all, it makes more sense both economically, as I said, and also, of course, it's just the right thing to do morally.
Yeah, absolutely. You mentioned sort of how it is in other countries. How does the situation, I guess, compare in Israel to what is happening in other countries who also have public healthcare systems?
Yeah, so we talked about it a little, but I can say that when you look at other OECD countries with public healthcare systems, they all have medication co-payments. We're not different in that. Mm-hmm. But the big difference is that all of them have better financial protections for vulnerable populations.
Okay.
Which means, for example, exemptions from payment for low-income households.
Oh, wow.
Or for chronic patients or for certain age groups, such as older people or children. And in Israel, we don't really have any exemptions, except for Holocaust survivors, which are today a very small part of the population. It's like 150,000 people in a population that is, 9.5 million people. So exemptions don't really exist, and we must have a lot more exemptions. We think exemption from all prescription drugs, but if not that, then other kinds of exemptions that exist in other OECD countries. Now, we do have payment ceilings, but it's not for all people with low income. It's only for chronic patients, and the ceiling is around 400 shekels, like $100 a month, which is too high, just simply too high for people with in low income households.
Yeah, absolutely. And in closing, I'm wondering sort of how do you see the future of healthcare funding and policy around payment in Israel evolving? Obviously, there's this moral and economic benefit, but what do you think that looks like, especially in light of some of the current economic and social challenges that you described earlier?
Yeah, I really want to be optimistic, but I just can't. The next few years in Israel will be hard financially. The government faces a 30 billion shekel deficit, and it needs to cover it somehow. And we think the responsible and right thing to do is to invest in vulnerable populations. But in the current political climate, I very much doubt that it will happen. So it seems we're going towards major budget cuts. And usually that means that the ones that are most in need will suffer first. So in this climate, I really doubt that co-payments for medications will be eliminated or lowered, but I think it's the sensible things to do.
Yeah. No, absolutely. I think everything you've described it exacerbates issues within these low income and vulnerable populations. It burdens the healthcare system further. It just sort of...
Yeah, but as I said, I'm not optimistic that someone in the government will have both the courage and the sensibility to, resurrect this issue that, when we face so many other challenges.
Yeah, absolutely. Unfortunately.
Yeah.
But thank you so much, Nili. I think this was incredibly informative and really a topic that you don't often talk about or think about when it isn't something that sort of affects you, but it's something that affects a lot of people.
So many people.
And so I really appreciate you sharing your expertise on this topic. Thank you, everyone, for listening. If you have any questions or comments, you can email us at mail@phr.org.il. Thank you, and we'll see you next time.